Hey, today I'm Abeshe J. Kumar. Yes, welcome to the platform. Today we are going to talk about issues that of the heart that people are born with. Issues of the heart that people are born with. Congenital. That's why they are called congenital heart defects. So Abeshe Kumar, if you have not subscribed, please subscribe to the channel and please like the flow as people come in. Today's topic is congenital heart defects. Congenital heart defects. We are supposed to start at 4. We have 10 minutes to start, and everyone who is will come in uh, about heart issues. Yes, go, I'm coming. I'm coming, I'm coming. Thank you, thank you. I'm coming. Tell Dorothy to come. Yes, yes. So if you're coming in right now, thanks so much. Baraka, follow. I'm coming. Eh? Um, uh, According to the title, talk about if you have a question about heart issues, it's this platform that you can ask any condition that you know. You can ask about heart conditions, you can any medical issue. This is the platform now. You can ask about issues. It is important when we are talking to note that you you when we discuss issues, it is good to interact. Dorothy, yes, mchukue vitals then uniite. Sawa. It is important to note that when we are discussing issues, your question always helps someone else. Your questions always help someone else because if you don't ask questions, some things don't come out clearly. So let's talk about congenital heart defects when a person is. So now that today we are not talking about the circle of Willis, we will remove the circle of Willis. Let's see how we can do it. We will remove the circle of Willis and removing the circle of Willis. Remove the circle of Willis. We remain with the heart. We remain with the heart because the heart is what we are discussing. The heart is what we are discussing. So we it is important we talk about these things. And first, you remember what we talked about how the blood flows of a child, how the blood flows or in the heart when a child is in a mother's womb. So let me invite in some more people so that when people are in and we are talking and discussing, things things come out clearly and you feel better. You feel better. So it is for you check this heart. I will discuss how the blood of a baby moves around the heart when a child is born. When a child is born. So a child is born. It's a Sunday. People are at home. This is a topic that of sensation, and it's not yet just preparation. This is a heart that we will use to discuss about several things that Okay, okay, that is okay. We need to learn how the blood of a baby, when you are a baby is in the womb of a mother. There are several things that we need to check out, like blood flow, how the baby eats, the nutrition, do the lung function when of a baby. You see, those are the things that someone should check on when he's handling congenital heart defects of a baby. Congenital heart defects of a baby means effects that you were born with. Problems that you were born with when you are young, problems that you were born with that when you were young. You see, this one is the heart, and this one, the other side that is behind me is the conducting system. So, as you watch the conducting system and congenital heart defect, let me come as I see one patient. We will start at 4:30 p.m. 4:30 p.m. So stay tuned as I come in. Stay tuned as I come in. Yes, I am here now. We want to talk of congenital heart defects. Thanks for everyone who has been waiting and waiting and waiting. Wamalizia tu nitaona on Tuesday. Waiting and waiting and waiting. You see how, you see, King Ray, welcome. Margaret in Norway, welcome. See how medicine is fun. You are home relaxed and you think you are relaxed, and you are cold and you have to come to hospital and work. You have to come to hospital and do what you are needed to do. Now, let me call someone. Let me call someone. Now, today we want to talk about congenital heart defects. If defects of the heart that people were born with, that you can be, or your child can be born with. There are so many people who are walking around with congenital heart defects, and it's important we check them out and we at least make them better. Congenital heart defects are issues of the heart, uh, are issues of the heart. Wait a minute. Congenital heart defects are issues. Yes, yes, come in. Hello. Okay, 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 okay. It's okay, no problem. Now, congenital heart defects are defects of the heart that affect blood flow, how your blood flows around your heart. You get it? And you know, when your blood around your heart is has a problem, you will have some problems. You see, when a baby is in the womb, a baby is in the womb, and this baby is still not yet to be born. There is a way blood flows around the baby's heart, and we saw it. It was so clear, and we saw how it flows. Now let's get down and see how the heart goes around and flows around the heart. Let's get and see how the blood flows around the heart. Now this one is the inferior vena cava. Inferior vena cava. Let me repeat so that we see how a child is born with some congenital heart defects. Here, at this point, I want to show you again, check out at this point, there is a hole in a baby's heart, a fetus who is in the womb. A fetus who is in the womb, there is a hole here, which is called foramen ovale, that connects this atrium to this atrium. And then from here to here, pulmonary artery to pulmonary vein, there is another one which is called ductus patent arteriosus. Ductus patent FSC, long time. Hi sister from, you told me you're from Zambia or Zimbabwe? Yes, Zimbabwe, I remember now. Like and let's learn. Now, when the blood comes from the mother's liver, it comes to the inferior vena cava. You get it? And then it comes to the right atrium. Instead of coming to the ventricles to be pushed to the heart, to the lungs, through pulmonary artery, this is what happens. It comes from this and goes through foramen ovale and goes to the right atrium. You see, it has come from the mother's liver. You get it? And from the mother's liver, it has oxygenated blood. So a baby in the womb should have now we let's have a continuity. Blood is here now. And when you know blood is in the left atrium, it is blood from the lungs. Boss one, yes, boss one, welcome. Today we want to study how, boss, I know you are smiling right now. Today we want to study how a baby is born with some congenital heart defects, effects that a baby is born with. So I'm just trying to give an overview of how the blood flows when someone is okay. The baby in the fetus is okay, how the blood flows. You see, now we have said about oxygenated blood from the placenta, reaching oxygen from the placenta, has come from the mother's, has bypassed from the mother's liver through the umbilical cord via the ductus venosus. Those are veins. It comes to the inferior vena cava. Remember, it is the umbilical cord. Then it comes, gets into the right atrium through the foramen ovale, and then through the foramen ovale, it goes to the left, from the left atrium to the left ventricle, out. From here, it goes down. Now, it has bypassed some, like the pulmonary valves. You get it? It does not, blood does not come to the left. So it is pushed. You get it? It is pushed. Wait. Someone is calling. Okay, someone is telling me something. So through the ductus arteriosus, blood is pushed to the outer patent ductus arteriosus, and then it goes to the systemic circulation. Ductus arteriosus is a hole that unites this and the here and here. You get it? So we get to, let me summarize it very fast. So that you can know. From umbilical vein, this is the normal, a baby having blood flow through the stomach, to the ductus arteriosus, to the inferior vena cava, to the right atrium. After the right atrium, it goes through the foramen ovale to the left ventricle, from the left ventricle, from the left atrium to the left ventricle. Then it is pushed here to the outer, to the brain. Now you get it. Now we continue to now issues that are affecting young children of the heart that are born with. If you have not liked, please let's like the let's like the video. If you have not liked it, let's like the video. If you have not liked it, let's like the video. It is important you like, we get more impressions if you have not liked it. So we want to see issues. Now there are several issues that are called congenital heart defects. They affect how the blood flows through the heart to the rest of the body. And there are some causes. We have some causes of congenital heart defects, like genetic factors. Have you ever heard about anyone who has ever heard about Down syndrome? Down syndrome. We will talk about these syndromes one day. Down syndrome is a syndrome that someone is born with, complication of the DNA and mutations when you are still in your stomach, in the mother's womb. You get it? One of it is Down syndrome. The other one is maternal infections, especially something called rubella virus. Greetings to you, Benjamin and the way and every stealing from my love. Oh, we understand, Uncle. We understand, no problem. We understand, Uncle. So there are some things called infections. Infections can, when a mother is pregnant and you are exposed to infections, infections can make you have congenital heart defects. Infections can make you have congenital heart defects for your baby. Maternal conditions like diabetes and those women that take alcohol when they are pregnant. Alcohol can mess up your child, especially when it comes to, we have something called embryology, and alcohol reduces folic acid in your body. And you see, embryology, the forming of your baby after conception really needs the folic acid. So if you continue taking alcohol, you may get congenital heart defects because of malformations. Certain medications during pregnancy, especially the medications that people use like for epilepsy. For epilepsy, they can cause congenital heart defects for your baby in the womb. Often, there are some unknown causes, but people say they are genetic. If you know, when people say it's unknown, mostly they link the causes with genetics of the family, maybe. But you see, you may find even some congenital defects, maybe it's not even genetic because it is not linked to anything. So what are the things, complications of the heart that a baby can be born with? Before I go to what are the complications and the classification, let me get to this. I repeat this. What can cause a baby to be born with complications of the heart? What can cause a baby to be born with complications of the heart? One, we have said is genetic. Two, we have said maternal infections like rubella virus. Maternal complications like conditions like diabetes and use of alcohol. Alcohol in pregnancy is not good, my friend. Alcohol in pregnancy is a